Hello, and welcome to the Achieve Optimum Health Summit, where we explore how to prevent and reverse chronic illness. I'm Angelina Kardash, your summit host, and today my guest is Dr. Neal Barnard. Dr. Barnard is an adjunct associate professor of medicine at the George Washington University School of Medicine and a president of the Physician Committee for Responsible Medicine. Dr. Barnard had led numerous research studies investigating the effects of diet on diabetes, body weight, and chronic pain, including a groundbreaking study of dietary intervention in type 2 diabetes funded by the National Institutes of Health. He has authored more than 90 scientific publications and 20 books. He leads programs advocating for preventive medicine, good nutrition, and higher ethical standards in research. Please join me in welcoming Dr. Neal Barnard. How are you doing today, Dr. Barnard?
I'm fine, thank you. Thanks for including me.
And today I would like us to talk about the science of hormones and how they are wreaking havoc on the body and the solution that improves health, reduces pain based on your book, Your Body in Balance, the new science of food, hormones, and health. So can you tell us what has inspired you to write the book, Your Body in Balance?
Well, it actually started almost accidentally. I was sitting at my desk and the phone rang, and it was a young woman who said she couldn't get out of bed. She had such bad menstrual cramps, she had to go on a business trip the next day, and she could really not function. Now, many women have symptoms along these lines, but for maybe 1 in 10, they're just off the scale, and that was her case. So she called me asking for painkillers, and I said, sure, I can give you some painkillers. But I started to try to think, how could we stop this from happening the next month and the next month? And so I suggested something that I don't think any doctor had ever suggested to any patient as a menstrual pain cure. And that was a couple days of painkillers. But then after that, for the next month, to go on a diet with no animal products and no added oils. She said, well, I'll give it a try. So she did. And she had no pain the next month or the next month or the next month. In fact, it was a cure unless she would deviate from the diet with, say, greasier foods or something like that. So I did a research study with our partners at the Georgetown University Department of Obstetrics and Gynecology, and we found that this helps lots of women, either to a smaller degree or a huge degree. And for some, it's an absolute cure. And then we started to discover more and more advantages of it. But it hit me as we were doing this research and related research into diabetes and weight control and many other conditions, that some of which are related to foods, getting our hormones out of balance. It struck me that doctors are not using this approach very much. They're prescribing medications and surgical procedures and all kinds of stuff. And B, so many patients don't have access to this information. So I thought, all right, I'm going to write a book, and I call it Your Body in Balance, meaning that hormonal disorders are really a sign of being out of balance, and we can use foods to get us back where we need to be.
So what are your thoughts on medication? So are they really highly overused these days?
Oh, yes, unfortunately. In the case of this young woman, a typical medical practice would be, here's some painkillers this month, and then next month, let's just wait to see if you get that horrible pain, and let's use medications again. And again and again. I'll give you another case. There was a young woman named Catherine, who I wrote about in Your Body in Balance. She was in the US Air Force. And unfortunately, she was tucking into cheese, grilled cheese, mac and cheese, all that kind of stuff, because like many people, she just loved it. And she started gaining weight. But as time went on, she also developed pain in her abdomen. And as her pain got worse and worse and worse, she went to see a doctor who had to actually look inside using laparoscopic surgery, looked inside and found that she had endometriosis. This is a condition where cells from the uterus start implanting all around the abdomen. They cause terrible pain. So what was the answer? Medication, hormone treatments, painkillers, none of which worked. So the doctor then scheduled her for a hysterectomy. And he said, well, you're infertile anyway as a result of this, you may as well just get all your plumbing out. And she was a little reluctant to do that because she and her husband were newlyweds and they hadn't yet started their family. The surgery was scheduled for 6 weeks down the road. before she could have surgery, she saw a nutrition a consultant who said, here's what I'd do if I were you. No animal products, keep the oils really, really low, put on a vegan diet that's a very healthy diet. And she started feeling better. But she was a very dutiful patient. She showed up for her hysterectomy when the day occurred. And the doctor inserted the laparoscope. You make a little incision below the abdomen, below the belly button, and looked inside. And then the doctor sewed her up and sent her to the recovery room, and she woke up about an hour later. And the doctor came in and said, I didn't do it. You still have your uterus. I didn't do the hysterectomy because for some reason I cannot explain, your endometriosis is effectively gone. And her mother was there with her, and her mother says, she went vegan. So at that point, the doctor said, no, stop it. You know, there's no way that diet, it doesn't cause endometriosis, and there's no way that a diet change is going to fix it. This has just got to be a miracle. That's all it could be. Anyway, what brings these cases together is that they're a case where hormones got out of balance. They got out of balance because of foods. Foods bring them into balance. And your question, I think, is the key one, is what the heck are doctors doing basically with medication? Medications have an important role. There's no question. And medical practice is a good thing. But doctors need to learn, they need to understand what causes things to get out of balance and see if there's a gentle way to restore it without medications, without surgery, with, you know, that a person may not need. Hopefully they don't need it.
Right. So do you feel that nutrition should play a bigger role in medical approach to, let's say, breast cancer or other hormone-related cancers?
Oh, yes, without question. Now, there is a role for a broad range of tools. Mm-hmm. And the usual things, medications, hormonal treatments, surgery, radiation, chemotherapy. There are all certain situations where these are going to be a big part of the discussion. But in hormone-related cancers, hormones are pushing the cancer. In the case of breast cancer, mm-hmm. we have known for a long time that estrogens, female sex hormones, increase the risk of postmenopausal breast cancer. Mm-hmm. Both for women and for men, a healthy, low-fat vegan diet is what we want to do. Now, when I speak of men, I'm speaking in particular of prostate cancer. But yeah, it's a good thing all the way along. So I guess I'm saying two things. First of all, in whatever other treatments a person may need, one should follow a healthy plant-based diet. And that means vegetables, fruits, whole grains, beans, really do bring in the healthy foods, the simple, natural foods. You will need appropriate supplements like vitamin B12. And it also means that if one does this, one may never need other treatments. So don't cancel your doctor's appointment, but by all means, let's make sure our breakfast is healthy.
So what are your thoughts on hormone replacement therapy? Is it safe and when it's needed? And can you talk about maybe different types of hormone replacement therapy for women? Is it safe to use only progesterone but not estrogen? And I know that some women cannot tolerate bioidentical estrogen replacement therapy. For example, they may experience an anxiety or depression. This is what I heard from my friend who's going through that. Okay, great. Women should certainly speak with their physicians about all of this. But it's understandable that women are going to ask because you're 50 or 51 years old and you're starting to get hot flashes and it's driving you crazy, and you're sitting in a meeting and suddenly you're sweating, or you're waking up 5 times a night with the same phenomenon, but when you're trying to sleep. And there are all kinds of other symptoms that go along with it. There can be sexual changes with vaginal dryness and so forth. And your memory will start to play tricks on you. You'll think, oh, am I getting old? I can't remember a thing. And you'll find yourself being, your mood might be a little bit off kilter. All these things can happen. But should a woman take hormone replacement? No. Generally speaking, no. And the reason for that is if a woman starts hormone replacement therapy, she's, for the most part, delaying these symptoms. They will knock out the hot flashes. But then your doctor at some point is going to say, we can't keep this up, because your risk of breast cancer is going up every year that you're on this. So we got to stop. And then you stop and then the hot flashes start again for some women. In some women, they just delay them. But the issue of breast cancer is a real one. And so I take it very seriously. And
the scientific research is now pretty clear. But to answer your question about is it progesterone, the worst highest risk does seem to be from these combination pills of an estrogen and progestogen. And I think some people have raised the issue that these are in some cases synthetic. And I think that's a reasonable thing. When it comes, it's a reasonable concern. When it comes to bioidentical hormones, people have said a sensible thing, which is if you prescribe Premarin, that comes from horses. Premarin was an extremely popular medication that still has a market. And the name Premarin stands for pregnant mare's urine. Horses are impregnated. Their urine is, while they're pregnant, their urine is collected, and somebody decided to name the medication after that. It's kind of creepy. So many women will say, wait a minute, there's horse estrogens in there. Maybe I don't want to swallow that. And they are right. I mean, frankly, from both the ethical standpoint, because it's a creepy business, but also from what you're putting in your body. But we have to be aware of one other thing. And you can take bioidentical hormones, meaning hormones that are a match for your own estrogen. But that doesn't mean it's safe. Your own estrogens will cause cancer. I know that sounds funny to say, but all hormones in the body, estrogens, testosterone, growth hormone, thyroid hormone, insulin, they all have to be in the right balance or the right level. If you have enough estrogen, fair enough, but if you have too much, even of your own estrogen, your risk of breast cancer will increase. Same way with insulin. If you have too little insulin, you can die. If you have too much insulin, you can die. Same with thyroid hormone, same with growth hormone. So I am very concerned about the idea that bioidentical hormones are totally safe and I can take them forever and it won't increase my risk. All the evidence that we have suggests that they will, unfortunately.
Can you tell me what causes hot flashes in menopausal women, and how we can prepare ourselves for menopause? What can we do?
I think there's a lot of pieces left out of this puzzle for the moment, but let me maybe paint a picture that I think gets us in the right direction. If you look in Japan, back in 1960, you had the thinnest, longest lived people on the planet. McDonald's hadn't arrived yet. And if you looked, and the diet was a huge amount of rice, some vegetables, not really very much meat, not even a lot of fish. They used these foods, but they were really kind of a flavoring for the rice and the vegetables and that. And dairy was not a big thing either. This was not an ice cream eating population. There was not pizza slathered with cheese. It was rice and vegetables mostly as their main staples. And interestingly enough, hot flashes were largely unknown. There was no Japanese term for them. And researchers started looking for hot flashes and they didn't really find them. And researchers would study the Japanese population. Maybe they're too reticent to complain. You know, maybe they have them, but they don't want to say anything about it. So researchers went in great depth and said to women, you know, do you find yourself sweating and are you fanning yourself? You know, they said, no, when I hit 50, I started getting some more back pain, but really don't have this at all. Then the diet westernized and several things happened. One is that women who westernized their diets approximately doubled their breast cancer risk. Weight problems came in. Diabetes came in, cardiovascular disease came in, all kinds of other issues. Depression came in to a much greater degree. Now, it's a dicey story to think, well, maybe people just didn't want to complain before that. That's all possible. But it looks like the health of Japan started to erode just as these products came in. And suddenly, hot flashes started to come in. So here's the theory, and I have no reason to dispute this. The theory is that when people are on a Western diet that has dairy and meat and so forth in it, it elevates estrogen levels in a woman's blood so that she gets adjusted to that level. Then when she reaches menopause, eventually, the ovaries stop. And so instead of having it be kind of a minor ripple, it's a big change. And then she's going to have reverberations for a long time after that with hot flashes. They will stop eventually. But we believe that had people gone into menopause on a low-fat, plant-based diet, chances are that the hot flashes would be less. We don't know that for sure because no one has done this as a randomized trial, but that's kind of our best guess.
So you mentioned low fat, but I also know that there is a school of thought which maintains that a very low fat diet can negatively affect sex hormone production due to the decreased level of total cholesterol. So what is your position on that?
Well, your body makes all the cholesterol that you need. And it's true that your body takes cholesterol, which is made in the liver, but the other cells of the body make it too, but especially the liver. And that the cholesterol is turned into testosterone, a little bit of testosterone, and more estrogen. And after menopause, it's called estrone. That happens. Your body doesn't need any help with extra cholesterol or extra fat.
Okay, okay.
Now, what I haven't answered, this doesn't mean that there aren't other issues that women are going to have to deal with menopause. So let's say a woman says, I want to continue to be able to function sexually, and I'm having too much dryness, and this is really not good. And so if a woman is deciding, I'm going to take hormones, you have a choice, which is, do you swallow them, or do you just use a little local cream or something like that? And the evidence that I have seen so far is that the creams are safer, and there probably is some systemic absorption of them, but nothing like swallowing the pill. And it doesn't have to be Premarin. I mean, there are brands that are not made from horses.
Okay, okay. Let's talk about the insulin. Insulin is a hormone that plays a central role in diabetes. And I know that you've done quite a lot of research in that area. So tell us about your findings.
Yes, 2003, the NIH gave us a grant to do a head-to-head test of the current diabetes diet, which was limiting carbohydrate and cutting calories to lose weight, versus a new diet, which was a vegan diet, no animal products, but we also kept oils very, very low. And that latter diet proved 300% better than the conventional diet at controlling blood glucose levels. Specifically, we used a test called hemoglobin A1C. And the improvement in people who were medication stable and they weren't exercising exactly the same, they improved 300% better on the vegan diet. And it introduced really two new things to think about. One is that diabetes can go away, which was something people really had, people did not contemplate that. The idea was once you have diabetes, you'll always have diabetes. And we started to see that you can make it go away, not in everybody, but in the sooner you catch the disease, the more likely. The other thing is that it put our attention on what really causes it. Type 2 diabetes starts as insulin resistance, which comes from fat building up inside your muscle cells and inside your liver cells. And when the fat builds up in the cell, you can't get glucose into it anymore. And so rather than worrying about whether you ate a slice of bread, let's clean the fat out of those cells by getting it out of your diet. And so that's what we do. That's the prescription, and it seems to really be the best one.
So would you say that the plant-based diet helpful for type 1 diabetes or only for type 2?
Well, with type 2, that's the condition where your pancreas is still making insulin, but the cells of the body are resisting it. And the pancreas is starting to slack off a little bit, but it's still making some insulin. So there we get the fat out of the cells, and the insulin you have is going to be able to work that much better. With type 1, the cells in the pancreas don't make insulin anymore. Those cells are dead, unfortunately. So you're going to need to inject insulin. However, the same diet still is helpful for two reasons. First of all, it allows you to reduce your insulin dose, often quite dramatically, 30%, 40% less for some people. The second thing is that in type 1 diabetes, what's going to kill you is not a high blood sugar or a low blood sugar. In the vast majority of people, what's going to kill you is cardiovascular disease, to the heart, to the brain, vascular disease to the kidneys, something like that. So what does that mean? That means baby your arteries. Don't put any cholesterol in your diet. Don't put any saturated fat in your diet. And that means throw out the animal products, throw out the coconut oil that somebody told you how to eat. I would avoid those things completely so that you are really taking the best possible care of your arteries. Lots and lots of vegetables and antioxidant rich fruits and so forth. That's the best prescription.
What role of sugar for the diabetic patients? Because I mean, we all hear that. Well, I mean, if you stop consuming sugar, you can be free of diabetes. So, what's your position on that?
It's not true, but that's a myth that it's been around for many, many years. And you can understand why people would say that, because diabetes means that your body can't store sugar effectively anymore. And so, and a person with diabetes will eat sugar and their blood sugar will go really high. So they'll say, see, it was the sugar was the problem. That's the problem, is that the cells have filled up with fat that interferes with insulin's ability to work. You should be able to eat sugar, and it should be able to get into your cells, because when I say sugar, I mean if you take a bite out of an apple, or an orange or a pear or some pineapple, sugars, simple sugars, are in fruits. And that's the natural energy source for not just humans, but all great apes. And so if you can't handle sugar, that means there's something wrong in your body. And let's fix that, rather than saying, don't ever eat another apple again. So that's the idea.
Can you talk about safety consuming soy products? So there is so much conflicting information out there, and most people stay away from soy products, especially men, due to the high concentration of isoflavones that have estrogen-like properties. So there have been some concerns that soy might lower a man's testosterone level. So can you clarify whether it's safe to consume soy products, and especially for adult males?
The short answer is it is not only safe, but it's a good idea and advisable. And I say this, we don't get any funding from the soy industry or anything like that. They're totally optional, but let me tell you what science has shown. Okay. It was, I think, the 1930s when researchers discovered isoflavones. They're in soy, there's some in some other foods, and there are related compounds. And they do seem to attach to the estrogen receptor on cells. So naturally people would think, okay, if I'm a man and I eat soy, maybe they will have estrogenic effects. And what does that mean? Some men think it means they'll have breast enhancement, so-called man boobs. And so there are men who imagine that if they eat soy, this will happen to them. And if a woman consumes soy, the concern is, could she get breast cancer as a result? Or if she has had breast cancer, would it be more likely to progress? Those are the issues. Mm-hmm. So we've had plenty of time to look into these and to study them very carefully. And the first thing is, with regard to men, go to the beach on an August afternoon. And if you pick out a man who's wearing his swim trunks and he's got some kind of breast development, he's a chunky guy and he's got what looks like breast, go up to him and ask, how much tofu have you eaten this past week? Did you have some miso soup this week? Have you been having tempeh? And he's going to say, what are you even talking about? I'm a burger guy. I eat pizza. He doesn't eat any of that stuff. The reason he has breast enhancement is that he's gained weight. And if you gain fat cells make estrogens. Body fat takes a man's testosterone and it converts it through the body fat into estrogen. Let me be really clear. A man's body makes testosterone. Fat cells convert the testosterone into estrogen. Mm-hmm. And if you're not convinced about this yet, think to yourself, if estrogen, if soy is estrogenic and Japanese women consume huge amounts of soy, do you think of Japanese women, and forgive me for how sexist this might sound, but do you think of Japanese women as being very busty and well endowed? And is that your idea of this population? I mean, let's get real. So with regard to women and breast cancer, researchers have studied this, and they've looked at women who consume little or no soy and compare them to women who eat a little bit of soy and to those who eat a lot of soy, particularly like Asian American women or Asian women. And within Asia, some women consume a lot, some women consume none. And the pattern is very clear, that the more soy a woman eats, the lower her risk of developing breast cancer. Maybe about 30% less. And if a woman has had breast cancer in the past, a high soy intake cuts her risk of recurrence by about 30% too. So the way to think of it is that soy does affect breast cells, but in the same way as your car has a gas pedal and it's got a brake, and where you put your foot influences whether the car goes or stops, soy hits the brake. So there you have it. You don't have to have soy, it's totally optional, but it's not a cancer promoter. If anything, it's it defends you against cancer. And that's not just because of its intrinsic properties, but because a soy burger is way better than a meat burger. Soy bacon, soy sausage, much better than pork bacon or pork sausage.
Okay, okay. Let's talk about the birth control pills. They have revolutionized life for hundreds of millions of women by giving them freedom, to choose when they want to start having kids. But on the other hand, there is so much evidence of how detrimental the birth control pills for women's health. So can you tell my listeners how birth control pills cause health problems, and what is your advice to women of reproductive age as a choice of contraception?
It's not for women, for me to tell women what they should do. Birth control pills, by and large, do have a relatively safe, good safety profile, particularly since you're going to weigh it against the alternative, which might be pregnancy. Mm-hmm. And they do have the benefit that you described, which is that they allow women to choose for themselves what should happen in their bodies. That said, I think we're making a mistake if we don't acknowledge that they are hormonal medications, and that they do increase the risk of breast cancer slightly. So, I mean, there are risks. The risks are quite small, but that doesn't mean that they're zero. So I think it's each woman's right, and it's quite appropriate for her to make choices for herself in consultation with her healthcare provider, who can helpfully advise. I should say that we had kind of hoped that the lower dose preparations that are out now might have less contribution to breast cancer. We would have to assume that's the case, but so far we haven't seen that to be the case.
Okay, okay. What blood test would you recommend for women just to see if they're healthy and what is their, hormone health?
It's a funny thing. We used to always recommend that people get annual physical exams and that they should be tested for this, that, and the other thing. I think we are becoming much more minimalist now as time goes on. That if a person doesn't smoke and their alcohol is little to none, and they're following a healthy vegan diet, you probably don't need any blood testing on any kind of regular basis. Now, most doctors would say, at least at some point, check your cholesterol. But if your cholesterol is high, what are they going to recommend? They're going to recommend a healthy vegan diet. And statin drugs and so forth would be reserved for those cases only where a plant-based diet didn't do the job. Now, some doctors do look at other things as well. They might check a vitamin B12 level, but all women should be supplementing vitamin B12. So normally you wouldn't need to check that. Doctors will also check vitamin D levels. If you're getting plenty of sunshine, that's nature's source of vitamin D, so it may not be so much of an issue. And I have to tell you, everybody turns out when they get their vitamin D levels, almost everybody seems to be low in vitamin D. So they then race to the drugstore and they pick up their vitamin D prescription. I think we're still trying to sort out what that's all about. So there you have it. Those are some of the main issues that come up.
Okay, okay. Americans today facing an epidemic of chronic illness, right? We've talked about, diabetes, cancer, heart disease. So in fact, chronic illness is now the biggest single driver of medical cost. So can you talk about our current state of the healthcare system and what is wrong with that and why we have so many chronically ill people?
Wow, what a question. Yeah, I think you've asked really such an important question because what you said is right, that half of Americans die of heart disease, roughly a third get cancer. As many as 30% already have, at certain age brackets, have either pre-diabetes or diabetes now. And all those are getting worse. And then toward the end of life, Alzheimer's disease appears to be a growing epidemic. These are not, for the most part, driven by genes. They are driven to a very large degree by food. And so if we tackle them, it may be that there will be less pressure on the medical system for dealing with this. As we've been describing, let's say a woman is having menstrual cramps and the current treatment is go to the pharmacy and get birth control pills because that'll regulate your cycle, or go to the shelves in the store and get painkillers and take all of these things. And you can see we're driving healthcare costs up and up and up. Fertility in your body in balance. I have a whole section on fertility, and I mean, so many people, I imagine, and I know many, many people who are concerned about their fertility, and some are spending hundreds of thousands of dollars on fertility issues. When we have found that when people get away from animal products, cheese, for example, has estrogens in it, and men in some studies who eat the most cheese have the lowest sperm counts. So let's tackle that. It's an amazing thing to see what happens when people do tackle these things. Now, having said that, a little political point here. I do believe that healthcare should be treated as a right. And I am always impressed by the fact that although every civilized country on the planet has some kind of healthcare system, and here in the United States, we treat it like a luxury, my own belief is that has to end. I think we have to provide healthcare. We have to do it for everybody. And if a person wasn't sick to death of the current plans that we have, when we set up our Barnard Medical Center in Washington, D.C. in 2015 and opened our doors in 2016, arm wrestling with all the insurance companies to deal with this morass of regulations that we have, I really think it makes the strongest case for following the example of other countries where they treat it in a much more reasonable and effective way. I have a good friend who is from Belgium, and she always tells me about how easy it is for her to get a medical appointment and how cheap her medications are if she ever takes them. And she says, "What's the matter with you Americans? Good heavens." I do think we have to solve that.
Okay. Tell us about the Physician Committee for Responsible Medicine and its mission.
Well, we started in 1985, and our missions are to promote preventive medicine. And as part of that, we do clinical research trials, some of which I described, to really find out what is the best kind of preventive medicine and the role for nutrition in that. And I think we've been successful in that so far, but we got a long way to go. We also, as part of that, we educate doctors. We have a huge conference every year where it would just warm your heart to see all these doctors coming to Washington, D.C. to learn about using their, they're using their pen to write out nutritional guidance as opposed to prescribing drugs. But we also have another side, which is to try to reform how research is done, so that all those researchers trying to create diabetes in a rat and Alzheimer's disease in a mouse will focus on human biology. I think that's what we need to do. Both for ethical reasons and also so that we get findings that we can use. So that's what we're doing. Our website is pcrm.org, and I hope that people will learn about what we do and that they'll join us.
Awesome, awesome. Well, thank you so much, Dr. Barnard, for being with us today. And I deeply appreciate all the work that you do in the world. Your Body in Balance book gives new hope for people struggling with health issues. And I know that thousands of people already reclaimed their lives after reading your book and following the lifestyle changes that you described in the book. And thank you for taking the stance and educating people on how to prevent chronic conditions through strategic dietary changes, because it works, it's very powerful. And that's just amazing message to the humanity.
Well, thank you for spreading the word. You'll inspire and educate many people, and you'll never know how many lives you've saved. So thank you so much.
Thank you for watching us today. I'm your host, Angelina Kardaj. Stay healthy always.